Can they be moved as a true and accurate record, please?
Yes, Chair.
Is that seconded? I'm getting nods.
Yes, Chair.
Thank you. Is that agreed, therefore, by all? Yeah. Item 6, COVID-19 National Overview. I'll now ask Rupert, Director of Public Health, to present this item. Rupert, please.
Thanks, Ros, and good morning, everyone. So it seems a long time ago, but we only met 3 weeks ago. There's quite a lot been happening nationally. The key overview nationally in that time in terms of numbers is we've seen another 19,000 new cases in those 3 weeks and also 221 deaths. And if people have been following the national data, you will have noticed that in the last 2 weeks there's been what's called a slight uptick, so a slight increase in the number of cases that are being reported. The national R value is still hovering around 1 and just under the 1. So that's what's been happening nationally. Just to update you in terms of what's been happening in the sort of the policy piece. You'll remember when we last met, we were expecting casinos, bowling alleys, skating, ice skating rinks, beauty salons to reopen on the Saturday. And the Thursday before, there was an announcement in the evening about further restrictions in Greater Manchester, West Yorkshire and East Lancashire because of increases in cases in Oldham, Blackburn, and there was an increase in cases in Kirklees and Bradford. So the opening of those new premises was suspended until the 15th of August, and along with that, nationally we suspended the piloting of crowds at sporting events, wedding receptions of 30 people. But we did go ahead and pause shielding on the 1st of August, and we did increase the use of face coverings in public places. What we also saw that week was an extension in the period of self-isolation that people who were symptomatic, who tested positive for COVID, should spend. So that increased from 7 days to 10 days. And we also saw the creation and then rather quick restriction of air corridors. So these air corridors being places that you could travel to, come back to the UK and not have to quarantine. And you remember 3 weeks ago, there were a number of places we could travel to, but very quickly Spain and Luxembourg came on that list. And more recently, we've seen France and other countries. We also saw the announcement of the Eat Out to Help Out scheme that would start from the 1st of August. What we've seen then over the subsequent sort of second and third week since we met was really the establishment of a national rhythm and a national watch list. So the Joint Biosecurity Centre now looks at the data, identifies areas on a Wednesday for discussion at a gold meeting on a Thursday, and that list is now published on a Friday as part of the National Surveillance Report. Authorities now are ranked into 3 or 4 broad areas. So essentially an area where you're ranked as having no additional concerns, and Doncaster's in that position at the moment. And then there are 29 authorities that are either an area of concern, an area of enhanced support, or an area of intervention. There are currently no South Yorkshire authorities in that 29. So that is a good situation. But what we have seen is continued restrictions in the northwest, in West Yorkshire and in Leicester. In the last week, there's been a few announcements that will start to impact us. So there's been an announcement about the strengthening of regional contact tracing. So where local authorities will have access to the NHS test and trace contact tracers. We've seen a change in the methodology for the way deaths from COVID will be calculated. So the new methodology is somebody is only counted as a COVID death if they had COVID diagnosed within 28 days of their death. Previously, we used nationally, we used a system where it was 60 days. So when the national data is rerun with that new measure in place, the number of deaths will come down. I expect us still to have one of the highest death rates, if not the highest death rate in Europe, though. We've also seen publication of data on antibody testing in the general population, which shows that maybe 6% of the UK population has had coronavirus. But that is a national average, so that will vary from place to place. And then just recently, we've seen further policy announcements confirming the easing of lockdown for, as we said, for the 15th of August for casinos, bowling alleys, skating rinks, and the beauty therapists in aesthetic industry, and that has that was done at the same time as an announcement about an increase in the fines for enforcement should people not be wearing face coverings repeatedly in public areas. We're seeing further increased emphasis on local contact tracing. We're expecting the evidence that the Department of Education and Public Health England have produced to be published today on transmission in schools. And then over the weekend, we saw an announcement on the establishment of a National Institute for Health Protection, which will combine the public sort of protection element of Public Health England together with the NHS test and trace system. On top of that, we are seeing increased requests for people to get involved with vaccine trials as well, Ros. So that's the national overview, Ros, and board members. Quite a lot happening, a lot of policy changes, but it does feel that we're setting into a rhythm now, particularly around the publication of the National Surveillance Report on a Friday, which identifies for the public those areas of concern, of enhanced support or intervention. But I'm happy to take any questions on that, Ros.
Could I ask people to raise their hand if they wish to ask any questions of Dr. Suckling, please? I do not see. Oh, Andy Pickering, please. Yeah. And then Paul O'Brien. So Andy first, please.
Rupert, could I ask you? Obviously, we've got these various air corridors, and obviously there'll be people coming in to Robin Hood Airport. Has there been any thought, bearing in mind there's a testing station at Robin Hood, to testing passengers as they disembark or shortly afterwards, or at least giving them the option to test while the facility is there?
So thanks, Andy. Good question. So the current I suppose UK policy on testing is to only test people with symptoms. So we currently wouldn't signpost people who had arrived in Robin Hood to go to the testing station at the airport. The airline industry is discussing with the government about whether they can bring in a testing procedure to test people immediately on arrival and then 5 days later to reduce the period of quarantine. But at the moment, the advice for those people coming back from a country that is in the air corridor is that they are okay to go about their daily business, assuming they have no symptoms. And for those that are coming back from somewhere that is no longer in an air corridor, they have to quarantine for 14 days. But think we will see movement on that in response to the aviation and the travel industry, Andy.
It's the reason I mentioned it, Rupert, is we seem to have with the testing site being at Robin Hood, we seem to have a perfect opportunity there. Is it something we could press for, or would wish to press for?
We would only want to press for that if there was sufficient capacity at the testing station. So you know how the airport works, where they have a number of flights that all land within a few minutes of each other, and we'd want to make sure that that didn't use up all the testing capacity that we also need for people who are symptomatic. So it is something that we're pursuing with the Ministry of Housing, Communities and Local Government in terms of how we want to respond to the air traffic passengers.
Okay, Rupert, thank you.
Thank you. Paul?
Good morning, Ross. Thank you. Yeah, Rupert, it's more a kind of a point as well as a question, I guess, around what can we do as an authority to support the police around the wearing of face masks. I think it's been noted by a lot of people, and I've seen it for myself, whereby trying to police the wearing of them in supermarkets, in the French Gate, places like Meadowhall, for example, people are still not wearing face masks in enclosed spaces. Tesco have been quite notorious. I've seen a lot of reports from them not asking people to leave or preventing people from entering Tesco's, for example. So the police, as stretched as it is, they already said when this came in that they're going to have a problem enforcing it. What can we do as an authority to try and help enforce that, police it, or put things in place? I mean, I know I've requested, and I'm disappointed that the authority's not taken that request up, around temperature testing. You know, I've been on holiday and I've been temperature tested 4 times to go into Alton Towers, to go into places in Wales where I went on holiday. And I've also been temperature tested when I took my car in for an MOT at my local garage. So places are doing things that I believe are supportive, that can indicate whether somebody's got an issue. And, you know, I think something like that, I'd like to see the NBC do more around that. And in particular, us be like a torch bearer in doing it ourselves. And act as a beacon for other people. So what can we do to try and help the police? Because people are still flaunting the use of masks in enclosed spaces, and that's a concern if we are to keep it under control, particularly in areas like Doncaster where we've done a decent job to date.
Yeah, thanks, Paul. I mean, it's a good question. The first sort of challenge is that whilst masks, face coverings, people are encouraged to wear those in public spaces, there are, of course, exceptions as to why people may not be able to wear face masks, either for health or other issues. And there's very little shops can do if they challenge somebody and they say that they don't require to wear a mask, wear a face covering. There's very little else that the shop can do in that situation. So I think there are some things though that the authority can do. So one of the things that we have set up is a system whereby where we have reports of premises where masks aren't being used on a regular basis or are seen to be used, we use our environmental health officers to provide some support into those premises in terms of a phone call or a visit to support them and see if there's anything else that we can do with that premise. Sometimes it is because people are unaware of the rules and regulations. Other times it's more difficult. The second thing that we can do, and we've been talking to the communications team, is to really ramp up some of our Let's Do It for Doncaster approaches and to make sure that it becomes more of a sort of normal approach to the way that we do things. And that definitely needs to be more targeted at the particular groups that maybe aren't wearing face coverings. The third thing that we have done is we have worked with the Inclusion and Fairness Forum through a number of their smaller groups to help them produce face coverings for people where the cost of getting hold of a face covering is prohibitive. So we are working on those three areas, Paul. But I would share your concern that we would want to. We see the use of face coverings as a key part of our strategy, but I suppose our response is really based on encouragement and support rather than enforcement, because the enforcement powers are limited and do stretch our colleagues in the police.
Thank you, Kurt. I can't see anyone else raising their hand. So are board members happy to note the presentation by Dr. Oh, hang on, sorry. Paul, do you want to come back again?
Yeah, please, Ross. Sorry. It was more around the point I raised, Rupert, about us not being effective in using temperature testing. Well, other areas are using temperature testing. I think it's something that would be a good idea. We can track and trace people's change in temperature help in terms of coming into places. So, I think it's something that I would like us to have a conversation around using, and maybe more signage around the encouragement for the face mask side. As you said, some people might not be aware of it. So whether we as a council can put more signage up to try and encourage people to wear them. Because I know Spain's now brought it in where it's mandatory to wear masks in public as well as in enclosed spaces, and you're supposed to wear the mask in the enclosed space until your food or drink arrives as well. So I know we're in a different place, but I'd just like us to go that bit further if we can, Rupert, and to Ros as well, I suppose, because when I was in Wales for 2 weeks, it felt a lot safer place there than it does in England, and they are temperature testing if you're going into a pub for a meal or wherever it may be. So I just think there's more we can do, and I'd like to think that we can try and do that. Thank you.
Thanks, Paul. So, board, if it's okay, what I suggest we do is we take that away for the COVID control board to have a look at. We will certainly we can bring the communications campaign back to future meeting, and also we can bring an update on temperature check, and I'm happy to speak to Paul outside on that as well.
That would be good. This is an overview board, Paul. The control board is another setting. I've now got another hand up. Councillor Jane Nightingale.
Thank you, Ross. It was just to say to Paul a bit of reassurances that obviously within the civic building and council buildings that are slowly opening, we are checking for temperatures with all staff and visitors to those buildings, so nobody can actually come into the building unless they have actually been temperature checked. There are things and plans in places for that. And also, I'm not one to go to a pub, but the only pub that I have been in, they did actually check my temperature before I went through the door.
Thank you for that, Jane. So with that, there is no more hands up. Are people happy to note what's been said, please? Can you? Yeah, I'm seeing nods of heads, so that's noted. Thank you. So we now move on to item 7, and it's what the data is telling us. I'll ask Louise Parker, Head of Service for Strategy and Performance, to present this item. Louise?
It's actually Laurie Mott who's presenting it, Mayor.
Sorry, Laurie. I'll ask Laurie to present this item, please.
Okay, I am here also, Ros, but Laurie is going to be going through the facts and figures for you.
Okay, thank you. I'm muting myself again.
Apologies for the confusion. John's on holiday this week, so it's me. I shall share my screen. Could someone just let me know when they can see that? Because it seems to be playing up at the moment. No, that's not the one you should be seeing. Yeah. No, sorry, that's not the wrong. That's the wrong one. It seems to be showing the wrong. Bear with me, I do apologise. Yeah. Sorry, I do apologise. Bear with me. Technology is not my forte, clearly. There, that should be it. Okay,
Yeah,
can anyone see that?
Yes, Laurie.
Yes,
Do
Laurie.
apologise for the slight delay. I'm not sure what happened there. Anyway, I'm going to give you a quick overview of what we currently know from the various data streams that we have access to here in Doncaster. Just briefly to mention the shielded population, as Rupert mentioned, from the 1st of August, the guidance has been relaxed. So the number of shielded residents remains at around or just a shade under 18,000, which is 6% of the population. That figure actually hasn't been updated since the middle of July, but I just thought I'd bring it to the attention of the board just to remind them that more than 1 in 20 of our population were shielded or should have been shielding, and it's worth bearing that in mind. Community infections. As of yesterday, Doncaster has reported 2,055 confirmed cases. And if you look at the graph at the bottom of the screen, you'll see that from a peak at the beginning of May, the number of confirmed cases has been falling fairly dramatically week on week. If you look, and I'll move this slightly because I'm conscious people's control panels sometimes hide things. But what you'll see here at the 7th of August, you'll see the slight increase in the number of cases that happened at the beginning of August. That's the uptick, I think, that Rupert referred to that happened nationally. And we've seen the same thing happening here in Doncaster. In terms of the 7-day rate, which is a rate that Public Health England used to monitor day-to-day changes in rates of COVID within local areas. And you'll see that our current rate is 5.2 per 100,000. And again, I'll just move, you'll see that the rate has been falling. Can everyone see that? I've made that slightly larger so you can see it, but this is the 7-day rate and the changes that have happened since the end of June. What you can see here is since the beginning of the month, since the beginning of August, that rate has begun to creep up, but not substantially, and remains still fairly low compared to what it was like a few months ago. Just for comparative purposes, Barnes's rate as of today is 20, but Rotherham's 16, Sheffield's 22, and England's is 11.5. So our rate, though it's climbing or has climbed, is still less than half the national rate. So it's just worth bearing in mind, though our rate has been increasing, our rate is still much lower than many of the places we compare ourselves to. The next part of what I'm going to report is something called the Exceedance Status, which is quite a complex indicator that Public Health England report to us each day. What the Exceedance report means is the number of positive cases we're finding as a proportion of the total number of tests we're undertaking. So this isn't about the population, it's about the number of people being tested. And you will go red if you are finding more people than Public Health England expected. So essentially they have a model which is based on the number of cases we've had in the past and the epidemiological curve that we should expect to see. Because the number of cases is so small, it actually is quite easy to go red. In other words, we need very few new cases over and above their modelled expectation to go red. So if you read the Exceedance reports, what they make very clear, or Public Health England make very clear, is that going red in and of itself is not important. It should be taken in the context of other things going on in the area. But the Exceedance report is one of the data streams that we have, and I thought I'd report it, but it's quite a complicated indicator to understand, and you have to be quite careful when you're interpreting it. But what you can see at the moment is across South Yorkshire, all of those local authorities are currently red according to the latest Exceedance reports. In terms of community transmission, we've had 5 total confirmed cases to date, and the test and trace programme 576, and nearly 1,000 contacts traced or identified. Sorry, not traced, identified. The main difference between when I think I last spoke to this board and now is we have a much better idea of how to interpret this data, as Public Health England have now made it available to local authorities, so we can see the names and locations of the confirmed cases, and we can also identify the individuals who are the contacts of those people. So we are currently working on trying to build a much more sophisticated picture of how where cases are and where their contacts are as well. Obviously, about 80% of those contacts tend to be family members or family visitors, but we've got a much better picture of what's going on in terms of test and trace now than we did a few weeks ago. In terms of incidents and outbreaks, there are currently 11 active incidents and 5 potential incidents that are currently being investigated by the IMT board. Of those 11 active incidents, 7 are in care homes. Now, that's a higher number than I reported last time, but it's, I think, a result. Now, Rupert will correct me if I've got this wrong, but I suspect this is a result of the active testing in care homes. And because we are proactively testing all care homes, we are identifying much earlier people who are not showing symptoms but actually have the disease, which means we have more incidents because with more homes we're identifying more people in these homes, but we're able to intervene much earlier, and so none of these incidents are exploding into outbreaks. And of those 7 care homes that currently reporting an incident, I think, and Rupert will correct me if I'm wrong, almost all of those will close next week because all of the measures are in place, and we're just making sure that those homes are continuing to act on the advice from public health. And all we're doing at the moment is making sure that there's no new cases acting. So though there are a lot more care homes identified, it's actually a good thing because we're identifying them much earlier, so those outbreaks don't run, I guess, out of control. In terms of our hospitals, we currently have a bed occupancy of 8. So there are 8 current beds being occupied at DRI because of COVID, and that number may actually be slightly lower. It's just the way we report that. There's currently 1 patient in ICU, which I believe is quite a complex case. But considering those numbers a couple of months ago, these are very, very small numbers. So very, very few people are arriving in hospital now with complicated COVID symptoms. And finally, now these death data that I'm going to talk about very briefly represent the old way of identifying mortality from COVID, and so these numbers will probably change in the next couple of weeks. But at the moment, we're reporting 263 deaths in Doncaster as a whole, and in the last week in July, we recorded no deaths at all. We believe there was a death in which COVID was mentioned on the death certificate on the 1st of August, and that was the first for about 2 weeks. So the numbers of deaths have been falling dramatically. We do have good evidence that if you take out nursing and residential homes from the equation, the people who are getting COVID at the minute seem to be much younger than they were at the peak of this disease. So that might be why we're seeing much fewer people going into hospital and much fewer deaths, because in fact we seem to be looking at a much younger cohort who are getting the condition. That's everything from me. I'm happy to take any questions.
I can't see any hands being raised, Laurie. Oh, yes, I have. Jane Cox. Jane?
Hello.
Hello.
Hello. I just wondered if, with the way we've the change in reporting of deaths, so we've taken COVID off if people died of another reason, has that affected our deaths in Doncaster at all?
The short answer is I don't know, but it almost certainly will. We'll have to see. ONS provide us with the best overview of deaths from COVID-19, and I'm presuming that they're making those changes this week. So there will be a reduction in the number of deaths because of the shorter time period between being identified and dying of the disease. So it will make a change, but I'm not sure exactly how wide, how large that, how big that change will be. I don't know.
I've got Paul O'Brien. Paul?
Thanks, Ros. Hi, Laurie. Can you just confirm
Hello.
what you meant by, hi there. Can you just confirm what you meant by the care homes are closing? Do you mean that's to new?
Oh, sorry. That was badly
Yeah.
expressed by me. Sorry. What I meant was the incident is being closed. So, in other words, there's been a case, a person has been identified with the disease, and all of the measures have been put in place. And once that person is better and no longer infectious, the incident will close. Not that the home closes. Sorry, that was a poor expression on my part. I do apologise.
Okay, I was just getting concerned. We got 7 homes closing then.
No, I do apologise. Should have been more clear.
Okay. Yeah, thank you.
Thank you. I've got no further hands raised, and therefore can I ask members to note the presentation by Laurie, please? I'm seeing nods of heads again, so thank you for that.
Thank you, Mayor.
Therefore, thank you, Laurie. We move on to item 8, which is changes and development in the public realm responding to COVID. I will ask Scott Cardwell to present this item. Scott?
Morning, Ros. Yeah, what I'll do is I'll give you a quick overview of an initiative we've been working on for several months. It started back in the middle of May, and it's really around responding to government announcements around bringing town centres back into use. And the remit of the work strand I was asked to lead was around making sure in that process people are kept safe and supported. Also, businesses are supported and helped to kind of flourish in what is a difficult trading environment, and also making sure everyone's kept up to date about all the changes. And I should also stress that this was not just a Doncaster town centre initiative; it was on the wider town network of Doncaster as well. So we established a delivery group which had 5 key aspects to it. We had an infrastructure group who were looking at physical changes to the town to help with social distancing. We had a group who were tasked with pulling a network of stewards together who would be council staff who would be deployed in the town centre, who would help support and reinforce social distancing and make sure people felt safe in the town centre and wider town centres. We also then had a very important group which was around engaging with businesses and also doing communications. Those communications would have been to members, would have been to partner organisations, but also importantly, they would have been to residents of the borough, because we needed them to understand that if they were coming into town, it was going to be a different space to what they would experience on a post-COVID element. We then also had a team who were leading on business compliance. So that was really trying to get across messages to businesses about what we expected of them and how to respond, and try and support them to reopen, but do it in a safe way. And obviously a big aspect of this delivery group was also partners. So the police were very much in the thick of it as well. We also had links in with the French Gate, the interchange, and also the wider kind of, not just the town centres, but also things like Lakeside shopping centres, the one on Barnsley Road as well. So we were keeping tabs on those as well. So some of the key activity that's been carried out is we've had, I suppose, 4 main horizons we've been working to. One was the initial response from government, where they were expecting changes to the public realm to try and make it easier for people to come into towns and be safe. So the initial response, we set up some enhanced pedestrianised zones in the town. Basically, we brought in some gates to the town centre and actually stopped vehicle movements in those areas. And the main reason for that was to try and maximise the space where people could maintain the 2 metre rule. So we brought those in very rapidly with regulation orders, and also at the same time as we were doing that, we deployed a lot of signage in the town centre. So there were repeater signs on all the street lights. We got floor splats on the floors, actually just reinforcing those messages to make sure people were assisted with that. And also we mobilised a network of stewards who were deployed on the town on a daily basis throughout the day, really just to make people feel safe, reinforce social distancing, and just be a helping hand to people. So the initial response, we came out the traps very quick, and we had a lot of positive feedback around the measures we put in. The next main horizon was the 15th of June, when the government announced when non-essential shops would be coming back into use again. Obviously, what that was going to cause is a spike in footfall going into the town to use non-essential shops. So we definitely did we saw something ridiculous, like an 85% increase in footfall when that happened. And so what we did to respond to that is we increased the network of stewards in the town to help deal with that capacity and just maintain that people were adhering to that. We also started to ramp up our licensing team and also the police's involvement with these premises that were opening up to make sure they were compliant and trying to make their shopping areas as safe as possible. Now the biggest challenge came with our third horizon, which was the 4th of July. Now the 4th of July was when licensed premises reopened. Now in Doncaster we've got something like 1,200 licensed premises. So this was a major initiative, and again, our licensing team worked very closely with the police, and basically they crafted a well-written letter that went out to all these licensed premises, actually setting out what our interpretation was as guidance of and how we were expecting to them. So we were trying to get businesses to create a safe environment. We also twin tracked that with a lot of social media through our comms team, which was literally going out to the residents. So they understood that, you just can't come in and go to a bar willy-nilly and order a pint. The vast majority of premises that were opening were going to be operating table service or booking services. And also there was only about 50% of the premises that were opening up initially in the town centre. So we had to manage expectations. The police also, with our licensing team, where they had a kind of risk register around some of the more higher risk premises where they thought there could be issues with social distance. Some of that might be just a locational element, but some of it might be to do with where there's been instances in the past, and they actually got a proactive visit ahead of that to make sure they were crystal clear about what the expectations were. So moving on to the 4th horizon, which is, I suppose, the post 4th of July, I'm pleased to say the arrangements that were put in place were effective. They were particularly effective through the day. So we had very few incidents to report, and mostly day-to-day things. The stewards network that we got in place, the signage and the kind of proactive work that the police and licensing team had done really had a positive impact to make Doncaster one of the safer places. What we had done is we continued with this public realm network up until the 27th of July. And that was basically monitoring the situation to make sure we were confident that the amount of issues that were being reported into this group were dwindling away, and that was exactly the case. It got to the extent where we were able to then remove the gating that we'd done for the vehicles, because we felt that we knew the town now had the capacity to deal with social distancing if we did reintroduce introduce vehicles back in there. So literally on the 27th of July, we'd had a couple of meetings where there were no major incidents reported, and we've disassembled that network now. So we're not meeting. However, should there be any changes or announcements from government where we do have to re-spark that network, we obviously would do. But at the moment, I'm pleased to say, as an initiative which spanned several months, it's worked incredibly well in terms of prepping Doncaster to make sure we were able to deal with the government announcements around bringing businesses back into place. And I think we were very supportive of businesses, and we did remove pedestrian areas if we were getting complaints from them about trading, if we felt that they were still going to keep people safe. So really, this is just a whistle-stop tour of an initiative which run for 3 months. We may have to bring the network back if, say, there was a big spike come through, or there were some changes in government legislation. But at the minute, it's just really to make sure you're aware that if we do have major problems like this, we have got a very effective partnership network that can respond and maintain, try and give businesses a fighting chance of trading, but also ensure that the public, first and foremost, are kept safe through that. So I'm quite happy to take any questions, Ross.
Thank you. Board members, any questions, please? Will you raise your hand if you've got a question? Andy's got his hand up. Andy, please.
Yeah, it's not so much a question, Scott, but just an observation. Obviously, the pubs seem to be the real potential problem areas if they're not run properly, and I'd certainly agree with that statement. One thing that's difficult is the monitoring of them, but all pubs, as I understand it now, should have their own CCTV. If we have pubs that I understand that neither SYP nor council officers can be everywhere at every time, but is there any good reason why officers couldn't request to see the public house's CCTV at what we consider might be key times? For instance, 10 o'clock on a Saturday night, and let's just have a look at their CCTV. Let's show, let's see what they've got in. I agree they might not want to show us, but that's that's a decision that they can take. But if we can just have a quick glimpse, and it is quick, the monitoring CCTV now is no big problem. It'll give us little snapshots of busy times and give us a clue of which pubs are sort of more at risk than others. I don't know what you sort of think to that.
Yeah, if I could come back in, Chair, on that. Yeah, we did have some incidents of that, Andy. I mean, it's a difficult thing when you have got bars operating and you have got people drinking. As they get intoxicated, then they tend to forget a little bit about social distancing. So we have picked up some things, the very things you're talking about on CCTV, and we have had those fed back into the group. And what's happened is obviously the police have been as responsive as possible to deal with it as those incidents are happening. But what we've also done then is where we have had things caught on CCTV, that's then gone to our licensing team, and the licensing team have then been doing follow-up visits to those premises to actually issue warnings around that type of activity. So you're exactly right. We haven't got the resource to be everywhere. We've got 1,200 licensed premises, but it is using things like CCTV proactively, and then having follow-up meetings with licensees to make sure they're under no understanding that they are being monitored.
The reason I mention it, Scott, is we've won. I shan't name it, obviously, but we've won licensed premise in our ward that is giving the sort of not only the elected members but a lot of the public. We get emails from the public about this place, and it would be useful if we could encourage them to cooperate a little bit more.
Well, it sounds like, Andy, if you just want to send me a quick email after this where the premises are, I'll make sure our licensing team and it's also flagged with the police as well for a visit and some proactive action, Andy.
It's already gone through, has that actually, Scott? Yeah,
Okay.
it has. It's already gone through, mate. Yeah, thanks.
Okay.
Okay, thank you. So no one else has raised their hand. So can I ask members to note the presentation by Scott, please? I think it's nodding of heads rather than anything else, and everyone switching on. Thank you very much for that, Scott.
Okay.
So we move on to item 9, which is the COVID Control Board held on the 5th of August. And I'll ask Rupert to present this item, please.
Yep, thanks, Mayor. So just a reminder for board members, underneath this board, there is a COVID control board that I chair. You've got the minutes of that meeting. I won't go through them line by line, but there were sort of 5 or 6 areas just to sort of highlight to you. So the board should know that that meeting regularly reviews the data and the incidents that Laurie has talked us through. And Laurie's right to have flagged up the sort of small increase that we saw in cases in early August, related partly to care homes, where we're starting to see is people who are testing positive 8 weeks after they originally tested positive, and we've taken a sort of no risk basis. So we have chosen to treat those as new cases. There's national work going on to understand whether they really are new cases, but in terms of preventing the spread, we have taken those to be new cases. The other thing around incidents that I think we will need to consider as a control board and maybe as this group is our position on sort of broader mass gatherings. So before we know it, bonfire night, Christmas light switch-ons will be upon us, and we do need to take a view on mass gatherings. So that's where we are with incidents. In terms of the outbreak plan, we signed off the outbreak plan, if you remember, last time. We are starting to receive some national action cards. So this is advice for councils, but also businesses, what to do if they have somebody who's symptomatic, and we are collating those. The bulk of the minutes cover the threat and risk assessment, and I do wonder, Mayor, if it would be useful to include the threat and risk assessment in full for you, so you can see that rather as a sort of glance rather than as a narrative. There were 3 sort of risks that the COVID Control Board has rated as high. So one that was high on the 5th of August and has come down since then is the management of cross-border incidents. So this is where people may live in Doncaster but work outside of Doncaster, or vice versa, and we've now got effective working relationships across not only South Yorkshire but with Public Health England in terms of that data. So that risk feels that it's come down. We still have got the testing and tracing as a high risk, and that really is because the system is so changeable. So with the national announcements and about the role of local authorities, so that still feels that it's a high impact for us. And the third high impact area is about our planning for the winter, and all local authorities are expecting to receive some information on what's called a reasonable worst case scenario. So essentially it's a sort of prediction as to what might happen if we had a second wave, and we would need to use that to look at further planning, and that obviously has impacts not just on local people but on the partners, so on police, on the health services, about how they respond. The final sort of 2 areas we touched on at that last COVID Control Board was the Let's Do It for Doncaster communications campaign, which we've asked Steph Cunningham and the team to develop, and we've already said we'd bring that back here at a future meeting. And then at the COVID Control Board tomorrow, we're going to receive an update from Leanne Hornsby on school reopening. And we're particularly interested not only in the schools and their reopening, but also the environment around the schools. So people may have picked up from Scotland, where the schools are reopening. They've seen the pupils abiding by their sort of social distancing and keeping in their bubbles in school, but then gathering around the local shops, disregarding social distancing and the bubbles. So we're going to review that as well, Ross. So that's what the COVID Control Board looked at that meeting, and what we've got coming up. And I do suggest that we see the risk assessment probably as a standalone document here. It's probably the best way to do assurance on that rather than through the minutes, Ros.
Thank you for that, Rupert, and I concur with you. It is best that we see the risk assessment here so that people can see it. Paul, I've got Paul's hand up. Paul?
Yeah, thanks, Ros. Rupert, just clarity, if you don't mind. I might have misunderstood how you said it. You said that you're getting people diagnosed 8 weeks after they've originally been diagnosed. Is that people that's had a second infection?
Yes, so we're seeing people who maybe tested positive in April or May as part of the original care home testing. As the care home testing rolls around and people get tested again, they may actually go negative and then become positive again, or they may still have a consistent positive 8 weeks after the original test. The original or the current advice from Public Health England is if you test positive twice within a 6-week period, that should be counted as the same infection. So if you test positive today and you're still positive in 6 weeks' time, that's essentially the same infection. But if you test positive again 7, 8, 9 weeks afterwards, we should really treat that as a new infection. And that's really to make sure that we've got the right public health control measures in. So what that triggers is, particularly in a care home, it triggers a visit from infection prevention control. We support then the home to review its working practices and its visiting policy. But as I said, Paul, there is national work going on to understand if that really is a true second infection, or is just the virus is still hanging about and our test is just so sensitive that it's still picking it up.
Okay. I mean, the reason, sorry, can I just come back on that? Sorry. So therefore, when the pandemic first initially started, and there was a kind of a myth that you couldn't catch it for a second time, then obviously there is the potential that people can contract it on more than one occasion.
So there is definitely people are testing positive over a prolonged period of time. What we're not sure of nationally is whether that does indicate a second infection, or whether that is just an indication that the virus is still present but you're not infectious. So until that is confirmed by the national research, the approach we've taken locally is anyone who does test positive again, we will treat them as if it is, but that doesn't mean, I'm not saying that does mean people get it for a second time, but that's in our in terms of our risk assessment, that's the best way to reduce the risk of further outbreaks at this present time.
Thank you. Councillor Ball and then Councillor Pickering.
Thank you, Matt. Yeah, it's just really in response to what you were saying, Rupert, in terms of some of the out of agendas. I mean, it's particularly worrying, obviously, heading towards winter when traditionally, I mean, people have gathered around events. I mean, it can be an element of sort of like raising spirits. Probably the one of most concern, which is heading up on the horizon, is obviously armistice. And we have an awful lot of well-attended armistice services and remembrance services across the borough. So we have a central one, but also ones in ward. And I suppose what I'm asking is, has there been any connectivity at this moment in time? I mean, hopefully we won't have a second wave, but potentially we may have. But has there been any connectivity and communication at this time with some of our partners in faith groups and also maybe the British Legion around this? Because this potentially could impact quite substantially with those services or those remembrance services. And obviously, you know, it's important that we have that forward planning on this.
Yeah, thanks, Nidge. So the council has an event safety group, and that has reformed. So it hasn't been meeting over the last over the period of the pandemic, because the current government guidance is that we should not be having mass gatherings. However, as you're seeing and we're seeing, you know, they're starting to test spectator events for sports activities. I think you're right to say that people who are planning, who would usually plan events in the autumn period, will be starting to consider what their approach is. In terms of a sort of a policy position, we would expect to have a government policy position on this. So we would expect something from MHCLG, but you're right to raise the need for us to be in contact with our local or, you know, sort of the people who we would usually be in contact about these events, and we will start to do that now that the event safety group has started to meet. And in fact, I think it's actually just meeting as we speak, Nidge. So I will speak to Jill Gillis, who chairs that, to make sure that we pick this up, and particularly around armistice.
Thanks for that, Rupert.
Thank you. Andy.
Yeah, Rupert, just going back to the people testing positive sort of 6-8 weeks later, are they showing symptoms, or are they just being picked up by the test?
So all of the ones that we've had so far are just being picked up with the test. They're not showing symptoms. What we really need is an effective antibody test, because that allows you to tell whether it's you've got sort of it's a previous infection or it's a new infection, and as those tests come online, that should help us distinguish two.
So no one else is raising their hands. So can I ask board members to note Rupert's presentation, please? I'm seeing nods of heads again. Thank you very much. Thank you, Rupert. And therefore, it allows us to go on to item 10, which is times of future meetings. There's a report there for Rupert. Your hands up.
Yeah, thanks. So just in terms of future meetings, so we've agreed for the next meeting to bring something back on the communication campaign. And if you remember from the previous meeting, we said we'd bring back the outline of the equality impact assessment on the COVID control plan. So just wanted to remind members that's what we've got coming up so far. I think you're on mute, Mayor.
I tried so hard to keep switching on and off. Thank you for that. So thank you all for attending and your input. And as no one else has raised any hands, I will close the meeting. Thank you all.
Thank you.
Thank you.
Take care. Bye-bye.
Thank you.